Welcome to a Frontline Reports podcast from Doctors Without Borders, Médecins Sans Frontières, or MSF.
My name is Sohur Mire, and I am a doctor trained in UK who is currently working for MSF in Somaliland. I'm working in Brow Hospital and in a paediatric ward.
Dr. Sohur Mire has only worked for MSF in Somaliland for 2 weeks, but it's not the first time she's witnessed war and malnutrition in this area. She grew up here before fleeing with her family in 1991, 9 months after war broke out. After 20 years away from Somaliland, first in Sweden and then in the UK, Sahor has returned to help people still caught up in the violence and insecurity that forced her family out.
I joined MSF because I have always found their work extremely important, and having the background that I have and being a refugee myself who fled the war in Somalia, I have always felt that the work that MSF has been doing in Somalia over the last 20 years was life-saving work.
Decades of war and food shortages have left the area poor and insecure, although it has escaped the worst of the violence in Somalia to the south. MSF's history here goes back to the 1980s. Today we run 2 hospitals in the towns of Barao and Erigabo. Before MSF arrived at the Barao hospital where Sahor now works, locals labelled it the Hospital of Death. High fees, lack of qualified medical staff and poor facilities meant fatalities were shockingly high. MSF teams arrived in January 2011 to start refurbishing wards, improve sanitation and hygiene and train staff. By March, the first MSF medical staff arrived and are now working in the paediatric and maternity wards. They have also refurbished and extended the operating theatre as well as running the pharmacy and laboratory. Sahor says Barao is no longer called the Hospital of Death, meaning the doctors' days are extremely busy.
This is a referral hospital for a huge region in Somaliland called Togdheer. We get people also from South Central, which is where the conflict is more severe and the drought is more severe. So the days vary from having a day when you have some emergencies to a day when all you have are emergencies.
Somaliland is one of the worst regions in the world to give birth in. The maternal mortality rate is about 1,044 deaths per 100,000 live births, compared to just 8 deaths per 100,000 live births in the UK and 11 in the US. And many children are malnourished and threatened by infections as they grow. So it was clear to MSF that we had to prioritise improving the maternal and paediatric wards.
This baby has just been brought here. The mother reports that it has been having diarrhea overnight, but no vomiting. At the moment it's looking mildly dehydrated, but it's alert, very active, and I'm not too concerned. However, we're going to make sure that we increase its fluid intake.
Since MSF arrived, the paediatric and maternal mortality rate on the ward has decreased, while the number of admissions has tripled. There are still many challenges for Sahor and her team, not least encouraging people to visit the hospital early enough for the medical work to stand a chance of success. This is not easy in Somaliland.
They don't have good roads, they don't have good links, but also they can't afford transport. It's expensive to travel from one place to the other, and so they delay access of healthcare, and also the health services are not in the rural areas. They are mainly focused in the towns.
Sahor is now back where her incredible journey began. She says she takes immense satisfaction from her work here and the ability to help people dealing with the same situations that she faced as a child.
We just like to thank actually the people who support our work. We see a lot of people who are suffering and we treat them to the best of our knowledge and capacity and resources. and it's extremely rewarding, and I like to thank those who make it possible for us to continue doing this work.
To find out more about MSF's work, go to msf.org and find the MSF website in your home country. Send any comments or questions on the podcast to msf-podcast@msf.org.